So, hello to the viewers. I've got Dr. Niharika, who has secured All India rank 14 for the NEET SS Medical Group 2025 examination. So, Dr. Niharika, hearty congratulations to get such an outstanding rank at the national level.
Thank you so much, sir. Thank you so much.
So, Dr. Niharika, were you expecting such sort of a rank like after the NEET SS exam?
Sir, to be very honest, the exam was very difficult. I
Okay.
thought the questions were really hard, and I did not study max a lot of questions. So I was expecting kind of between 50 to 100, but not this great rank.
Right. And is this your first attempt?
Yes, sir.
And which college did you do your post graduation from?
Sir, I did my post graduation from Lady Harding Medical College, Delhi, and undergraduation from Maulana Azad Medical College, Delhi.
Right. So that is great to know. And so, Niharika, you have got such a good rank at the national level, and I'm sure that the viewers would want to know about your preparation journey, especially that you have cracked this in your first attempt. And I assume that you did not get much time, right, post your MD to appear for the exam. So, first thing that I want to ask you is regarding, MCQ practice for the NEET SS preparation. So, how useful were the doc tutorials question bank in your preparation journey?
Sir, I subscribed to the Doctor Tutorials program 1.5 year back. So I started using question bank very early, even during for my MD preparation, because I thought that solving questions increased understanding, and there were some like very good questions. Like when you read books, when you read Harrison, you don't give much attention to those points, but after you solve questions, then you start realizing the importance of those things. So I started doing questions very early, like in the end of second year, and I also started giving tests also.
Right. Right.
So the
And
question helped me in reading Harrison's also and interpreting it also.
QBank as a tool, did it actually help you in retrospectively reinforcing your knowledge on a particular topic?
Yes, sir, definitely. In I almost all subjects I solved the Harrison-based question bank. All subjects.
Okay.
So they were really good, especially the Harrison-based questions, the line-to-line pointers, and the even the conceptual questions. So yeah, they were very helpful for me.
And this time, NEET's exam had slightly more questions from environmental emergencies. And was that a surprise for you during the exam? Just take us through that.
Yes, sir. I when I was studying, I read the topic environmental medicine, but I thought that hardly two to three questions would be there. So I did solve the doc tutorials one, and surprisingly, there were a lot of questions, not directly, but like on the similar concepts. So the
Right.
Q bank of the Harrison-based doc tutorials is very good. Even this unpredictable paper also.
I always tell my students about solving grand test because I feel
Yes.
the real test is the GT, wherein you can just assess your performance and find room for improvement as well. So, in your preparation journey, how useful were the doc tutorials grand test?
Sir, I started taking doc tutorials, grand test, just after my MD exams, like in the last 2 months. The frequency was around, I think, once in 2 weeks or 3 weeks. So I read, I read the topics and then I did the GTs. And to be very honest, the giving GTs boosted my confidence that I was getting some certain ranks in those tests. So that also motivated me to do further because of less time, I even considered taking a drop year, but your grand tests really motivated me and boosted my performance. And I used to review them questions diligently. And even the last GT, I think it came 3 to 4 days before the final exam. It
Yeah.
also opened my eyes and boosted my confidence. So yeah, I'm really grateful for that.
And when you gave all those grand tests, how consistent were you in your performance? Like, if you can just tell us about your ranks in those GTs. Did it actually help you in, okay, these are the areas where I'm lacking. I should be just giving a bit more emphasis to those topics. So, how did you use those grand tests?
Sir, the first GT, I think I got something 50 to 60 between ranks. So that was really like a kind of a shock to me because it was my first and it was such a great rank. So it motivated me to study further. So
Okay,
in first GT, I think my biostatistics subject and I think cardiology and neurology were weak. So I
okay,
started focusing on those subjects. Then in second GT, they improved and also my ranks improved.
right.
And yeah, there were weak points like I think your GT is focused on environmental medicine and biostatistics also, which we generally tend to ignore in our MD days. So that helped me to read further on these topics.
And when you were preparing for this NEET exam, did you actually go through the previous year questions as well, just to get an idea on the type of questions being asked, the
Yes,
PYQs?
sir. There's a module of previous year questions in your doctorations app, the QRP. So I did that. I solved all the papers.
Right. And when you are in residency, I was just taking an interview just a while back, and again another candidate who has got in first attempt. So that candidate also was of the opinion that a case-based learning during residency definitely will help you for such competitive exams also. So your take on
Yes.
that?
Yes, sir, definitely. There were a lot of conceptual questions. Like, I used to think that I did this in emergency, so I marked
Okay.
that option. So,
Right.
yes, definitely.
Right. Now, anyway, you have got this wonderful rank. I think you have got multiple options and avenues in front of you, and
Yes,
I wish
sir.
that you know you can take any college now. The branch that you want. So I
Yes.
think it's a good confusion to have sometimes, right?
Yes.
In life.
Yes, sir. I'll decide. I'll even talk to you about this after some time.
Right. So I think,
Yes.
Niharika, I think very useful insights. I think what I gained out of this interview, which I want to communicate to the juniors, is that look, she has done it from a college where you've got hectic duties as well. But I think the case-based learning that she did during her residency, with aggressive solving of questions, that is very important because many a times people keep watching videos alone without doing questions and grant tests. But I think she has diligently done the question bank, and I think you have given almost all the grant tests as well. So
Yes,
that
sir.
definitely has helped her in achieving this wonderful rank. So thank you so much, Dr. Niharika, and wish you good
Thank you,
luck
sir.
for your future as well.
Thank you, sir.
Thank you so much.